So I will explain a little bit about a few issues that the kids have with dysplasia of the hips, dislocation of the hip. And in most of the cases, it basically looks like this. So it's not a classical dislocation that you can imagine that can happen to a healthy person. The kids with cerebral palsy, they actually have a lot of issues, not only with the joint, but they actually have problems with the whole spine and actually the whole pelvis. In most of the cases, the biggest issue that they have actually is originate from the spine. So there is a tension from the spine that convert into the pelvis orientation, and the pelvis orientation bring the the legs orientation too. And usually we have some situation that we call a windswept pelvis. Windswept pelvis means the pelvis that is tilted to one side. When the pelvis is tilted to left or to the right side, we have asymmetry in the leg positions. And usually the hip that is negatively affected by that is the one where the pelvis is raised up. So basically the hip that goes excessively into internal rotation and abduction. Now that kind of position in long period of time is actually weakening the connective tissue, lateral connective tissue that is very important for the stability of the hip joint. So basically in time the child actually have stability issues with that joint. Now the other thing that happen when you have a stability issue with the joint is ability to transfer the load or weight or any kind of pressure from the leg and with the pelvis. So basically the legs become disconnected with the spine and unable to transfer the load towards the spine. So let's talk a little bit about that. So I will make a drawing of, let's say, a more or less good pelvis. So we have an iliac bone, then we have a roof or acetabulum, then we have a hip with the angle, with trochanter, and so let's say this is a situation where we have a roof, we have a good fascial connections, we have basically the situation that is working well. Here is the sacrum and there is the spine. So in this situation the child is able to connect basically the legs with actually the spine. So any kind of movement with the legs and weight bearing is able to transfer from the leg through the roof, through the sacrum, sacroiliac joint and iliac crest towards the spine. And the spine, if it's good spine, the spine will able further to transfer that weight or load in such a way that the whole body is engaged. But any kind of activity when the legs are in the position to hold the body weight or do whatever they're doing. So for this kind of situation, it's very important that hip as a joint have appropriate have two very important functions. So every kind of joint have two functions. It's function of connecting, but it's also function of disconnecting. Now, function of disconnecting is more related to movement, but also function of connecting is more related to load bearing and ability to transfer the load from one segment to the other segment, which is very important because if you're not able to do that, one segment is actually overloaded, and this is the place where usually we have collapse or leakage of that excessive force. So in the situation where we have a depleted structure, like I said, it's never really just a joint issue in a way of dislocation. So it's never really kind of this situation. I never saw this actually. It's always like this. So we don't have a roof, we don't have the neck, and we don't have appropriate head, right? And usually this is also related with a certain tension coming from the spine that created the wind-swept pelvis. So this leg is the leg that is going towards the inner rotation and adduction. So basically it's coming towards the middle line. So when it's in this position for a long period of time, that position is slowly starting to form the structure. And that structure means that all the connections, the lateral connections here, are actually under stretch, let's put it like that. And this main stretch or daily position is actually disrupting the stability of the hip. Now when you don't have stability of the hip, you have movement. The movement is limited because there is a muscle spasm, and muscle spasm is related also with instability issues that can cause pain. So basically, if you move the healthy hip or the leg, the movement is actually happening in the hip. So this is the place of the movement. But if it's unstable, any kind of initiation of the movement can cause the hip actually to move around excessively to one side or to the other side, and actually start to stretch and push the surrounding soft tissue, and that can cause the pain. So basically, you have a protective spasm and muscle stiffness. And we don't see this only with the kids that have a cerebral palsy. This kind of situation we can see with anybody who have any kind of instability issues with any kind of joint. So for example, if you have a very unstable shoulder joint because you dislocated it a couple of times, your muscles are not going to be relaxed there. You're actually going to have more tightness there comparison to the other one. So the tightness of the muscle is related with instability as a protective mechanism of the body to basically save this spot and to overlap or overbreach the inner weakness. So we have the same thing in this picture here, but now let's talk a little bit about the ability to transfer the load from one segment to the other segment. When I say the load, I mean this: you step, and basically the force is coming through your leg all the way towards your head. So you are able to link all the basically the segments in your body in one chain that use the load, the compression as a source for stabilization, basically. So for that, we need to have ability for every hip, every joint in our body. It need to be stable enough to transmit and to deliver the load from one segment to the other segment. If that is not the case, and the case would be I'm pressing the leg, or the person is stepping on the leg, and that force should go towards the spine and go up. But if the person have very unstable hip, then instead of going up, the force starts to leak. And the whole hip move, and the whole hip basically is starting to press and squeeze the surrounding tissue. So now we have a leakage of the force. So less force actually is going towards the pelvis and is going towards the spine. So this person is actually doesn't have ability to use the whole body because you have a leakage of the force. If you have a leakage of the force, your spine will not be the one that is carrying your body. That is dealing with the ground force reaction. That ground force reaction starts to leak into this collapse of the hip, and collapse of the hip have a tendency to create even more instability in that area. So we have to be very, very careful if we actually use weight bearing as an exercise for this kind of depleted structure. So some would say, well, weight bearing is very important because it's building the joint, is building the roof or acetabulum, it's building the iliac crest, it's building the neck of the hip. And at a certain degree, that of course that is true. We can see the people who are not walking and the ones that are walking, the bones and the structure does look different. But we must not forget that when the baby was just born, the hip was not ready for walking, and the hip was ready before the child actually started to walk. So there are many things, many kind of mechanical impact that you can give the child that will benefit, that will create a good beneficial circumstances to the hip, and it doesn't have to be just standing, right? Because the baby is not exercising the hip structure by standing, it's doing many other stuff. But even if you do use the load transfer or weight bearing or pressure on the hip joint, you have to be sure that you will not get the leakage in a form of collapse of the hip. So if you create mechanical environment in such a way that you use different kind of materials around that will stream the force where you want to go and connect the legs with the spine, then you are on the right track.